Happy Monday. I was reading this article in People magazine over the weekend, and it's really interesting. You can see this gal here has gone abroad outside of her home country to have some inexpensive plastic surgery, and has the result that you see in the picture. And in healthcare, when things don't go well, there are some teaching opportunities there. In this case, she's got a complication called ectropion, which is where the lower eyelid is not opposed to the eyeball. And that can create all sorts of problems. Sometimes it happens transiently. In her case, it was permanent required surgical revision. And the good news is, surgical revision done properly usually works for this. I will say this about going abroad for inexpensive plastic surgery. Please don't do that. If my father used to tell me, if you don't have time to do a job right, then you sure don't have time to do it twice. And that's what ends up in most of these cases happening, because there are revisional or secondary procedures that are often required to correct this, usually at increased expense, when someone oftentimes could have had a procedure closer to home by a more reputable or better provider. I use the analogy renting or buying a house abroad. I did this when I moved to Nashville. We went online, we saw some great photos of an apartment for rent. We rented it, and it was a mess. We couldn't move in. So that happens. You wouldn't pick your house that way or your apartment that way, and I don't think you should pick your plastic surgeon that way either. Go on site, visit, have a consultation, and inform yourself about that provider and their office staff, and what happens if there are complications.